Hello, I am Dr. Lilia, an academic. In this video, we will thoroughly explore the condition of hemorrhoids, a sensitive topic for many. You will gain detailed insights into internal and external hemorrhoids, as well as diagnostic and treatment methods. If you suffer from hemorrhoids, please be sure to watch the entire video. 1. What should you know about hemorrhoids? Hemorrhoids, piles, are blood vessels located in the smooth muscles of the walls of the rectum and anus. They are a normal part of the anatomy and are located at the junction where small arteries merge into veins. They are cushioned by smooth muscles and connective tissue and are classified by where they are located in relationship to the pectinate line, the dividing point between the upper 2/3 and lower 1/3 of the anus. This is an important anatomic distinction because of the type of cells that line hemorrhoid and the nerves that provide sensation. Internal hemorrhoids are located above the pectinate line and are covered with cells that are the same as those that line the rest of the intestines. External hemorrhoids arise below the line and are covered with cells that resemble skin. Hemorrhoids become an issue only when they begin to swell, causing itching, pain, and/or bleeding. 2. What do external and internal hemorrhoids look like? Normal hemorrhoidal tissue cannot be seen since they must first swell and become inflamed or develop a clot to cause symptoms. One can see swollen external hemorrhoids or internal prolapsed hemorrhoids exposed outside the anus, but internal hemorrhoids cannot be seen because they remain inside the anus. A thrombosed hemorrhoid will appear as a lump at the anal verge, protruding from the anus, and will be dark bluish in color because of the blood clot contained inside the swollen blood vessel. Non-thrombosed hemorrhoids will appear as a rubbery lump. Often more than one swollen hemorrhoid appears at the same time. 3. What causes hemorrhoids? While the presence of hemorrhoids is a reflection of the normal anatomy, most people and care professionals refer to hemorrhoids as an abnormal finding because they only present when they swell and cause problems. Hemorrhoid swelling occurs when there is an increase in the pressure in the small vessels that make up hemorrhoids, causing them to swell and engorge with blood. This causes them to increase in size, leading to symptoms. Increased pressure may be caused by a variety of factors. A low-fiber diet and smaller caliber stool cause a person to strain when having a bowel movement, increasing the pressure within the blood vessels. Pregnancy is associated with hemorrhoid swelling and is likely due to increased pressure of the enlarged uterus on the rectum and anus. In addition, hormonal changes with pregnancy may weaken the muscles that support the rectum and anus. Prolonged sitting on the toilet may increase pressure within the hemorrhoid blood vessels. Obesity, diarrhea, both acute and chronic colon cancer, previous rectal surgery, spinal cord injury, and lack of erect posture. 4. What are symptoms and signs of hemorrhoids? Hemorrhoids are the most common cause of rectal and anal complaints. The most common complaint symptoms are painless bleeding from the anal area, anal itching, pain in the anal area, swelling, and feeling a lump at the anus are all associated with inflamed hemorrhoids. It is important to remember that rectal bleeding or blood in the stool is never normal and, while it may come from a relatively benign cause like hemorrhoids, more serious causes can be life-threatening. These include bleeding from ulcers, diverticulitis, inflammatory bowel disease, and tumors. If rectal bleeding occurs, it is important to contact your healthcare professional or seek emergency medical care. This is especially important if the person is taking blood-thinning medications. When internal hemorrhoid becomes inflamed, it can cause swelling. This in itself does not cause pain because there are no pain fibers attached to the veins above the pectinate line. Passing a hard stool can scrape off the thinned lining of hemorrhoids, causing painless bleeding. However, swollen hemorrhoids can also cause spasm of the muscles that surround the rectum and anus, causing pain, especially if they protrude or prolapse through the anus. A lump can be felt at the anal verge. Internal hemorrhoids can also thrombose, clot, leading to severe pain. Inflamed hemorrhoids can leak mucus that can cause inflammation of the skin surrounding the anus, causing burning and itching, known as pruritus ani. However, other causes of itching include yeast and other skin infections and parasites like pinworms. Most importantly, just as blood in the stool should not be ignored because it might be a sign of colon cancer, Anal itching or bleeding should not be presumed to be due to hemorrhoids because it can be a sign of anal cancer tumor. External hemorrhoids behave differently since they are covered by regular skin and have pain fibers associated with them. A thrombosed external hemorrhoid occurs when an underlying vein within the hemorrhoid clots off, causing intense pain from the rapid stretching of the skin covering hemorrhoids. A hard, painful lump can be felt at the anus. External hemorrhoids can also result in excess skin tags that can be felt at the anal verge and can cause difficulties with cleaning after a bowel movement, leading to secondary skin infections. 5. How are hemorrhoids diagnosed? The common symptoms of a hemorrhoid include itching, pain, rectal fullness or lump, and bleeding. The diagnosis is made by history taking and physical examination. The history may focus on the associated symptoms including constipation, hard bowel movements, and straining while going to the toilet. Other questions may be asked to look for other causes of rectal bleeding including tumors, inflammatory bowel disease, and gastrointestinal bleeding. Physical examination is performed to confirm the diagnosis and includes a rectal examination where a finger is used to feel for abnormal lumps or masses. Interestingly, internal hemorrhoids cannot usually be felt. The rectal exam may be deferred if there is intense pain or swelling. In addition, hemorrhoids and constipation may be associated with anal fissures or cracks in the skin surrounding the anus. The associated pain and spasm makes a rectal exam very uncomfortable. If the healthcare professional is concerned that the symptoms, especially rectal bleeding, cannot be explained by hemorrhoids, anoscopy may be considered. Anoscopy is an office procedure where a lighted tube is inserted to look at the anus. Sigmoidoscopy or colonoscopy may be ordered if there is concern that the bleeding is arising from other areas of the colon. These procedures are usually performed by a gastroenterologist or surgeon. Depending upon the situation, blood tests may be ordered. If there has been excessive bleeding, the hemoglobin or red blood cell count may be checked. If the patient is taking warfarin, Coumadin, an INR, International Normalized Ratio, or PT, ProTime, may be ordered to check for appropriate blood thinning. Please note that there are many newer anticoagulation medications available to thin the blood, and their activity cannot be measured by routine blood tests. 6. Can natural home remedies treat and prevent hemorrhoids? Regardless of the size or swelling of a hemorrhoid, no treatment is required if symptoms do not exist. Prevention is perhaps the most effective treatment. Diet and adequate hydration are very important to maintain normal bowel movements. Hemorrhoid symptoms can occur with the passage of hard stool and constipation, as well as diarrhea and frequent bowel movements. People with constipation may require a high-fiber diet, adequate hydration, and stool softeners. Those with too frequent bowel movements may require antidiarrheal medications and diet adjustments. These preventive measures decrease the amount of straining that is required to have a bowel movement, thus decreasing the pressure within the blood vessels to prevent swelling. The internal hemorrhoid always stays protruded or prolapsed and is at risk for thrombosis or strangulation should the anal muscles go into spasm. Grade 1 hemorrhoids are treated symptomatically. There can be some spasm of the anal muscles. Warm sitz baths, sitting in a warm tub for 20 minutes, 2 or 3 times a day may be helpful. Avoiding spicy food may also prevent anal itching. Over-the-counter medications may be helpful. 7. How are hemorrhoids treated? Once hemorrhoidal symptoms develop, a variety of treatment options exist, depending upon the situation and severity of the hemorrhoids. Internal hemorrhoids are graded by the degree of prolapse below the pectinate line into the anal canal. Grade 1. The internal hemorrhoid bulges into the canal but does not prolapse or fall completely into it. These may bleed. Grade 2. The hemorrhoid protrudes past the anal verge with straining for a bowel movement or passage of flatus, but spontaneously returns to its original internal position once the straining has subsided. Grade 3. The hemorrhoid may protrude past the anal verge without any straining and requires the patient to push them inside manually. 8. Will hemorrhoid surgery, hemorrhoidectomy, cure hemorrhoids? People who have failed conservative therapy or who have grade 4 hemorrhoids are candidates for surgery to remove the swollen hemorrhoids and the larger external hemorrhoid skin tags. Options include hemorrhoid removal with laser surgery or hemorrhoidectomy. Ectomy equals removal, using a scalpel. Another alternative is stapled hemorrhoidectomy, where a special staple gun is positioned to remove hemorrhoids and surround the tissue with a ring of staples to close the area as well as control the bleeding. A thrombosed external hemorrhoid indicates that a clot has formed in hemorrhoids causing significant pain. Treatment involves cutting into hemorrhoids to remove the clot and reduce the swelling. 9. How long does it take for hemorrhoids to go away? Hemorrhoids are normal tissue and only raise concern when they swell, become inflamed or bleed. Hemorrhoids will recur after non-surgical treatment about 50% of the time, while the recurrence rate after surgery is only 5%. The goal is to control hemorrhoid inflammation by diet and hydration so that surgery is not required. In this respect, hemorrhoids are a lifelong condition to be controlled and not cured. Thank you for watching today's video. If you like this kind of content, don't forget to subscribe to my channel and click the bell to get updates on new videos. If you enjoyed the video, please like it and share your thoughts in the comments. I hope to see you again with more videos. I'm excited to share more interesting science with you soon.